Hearing is an important part of your health. In fact, your hearing affects your mind, body, and mood. Hearing loss can occur at any age and can be difficult, but there are treatment options available. Here today to talk to us about hearing health is Heather Steinle, a certified audiologist with Baptist Medical Group. Good morning, Heather. Thank you so much for joining us.
Thank you for having me.
Okay, the first question we always ask in our segments is tell us a little bit about yourself and how you became a certified audiologist.
Yes, audiologist.
I struggle sometimes with those big words.
I've been an audiologist for almost 19 years. I'm from Wichita, Kansas. I went
Wow. Kind of a long distance there from
yes.
Kansas to Pensacola.
Yes, my brother was in the Navy, and somehow my whole family ended up migrating down here. So
That's cool.
So I finished my doctorate, my master's at Wichita State in Kansas, and I worked at a manufacturer of hearing aids for about a year up in Minneapolis, and then moved down here, and I've been with Baptist since 2001. So just working as a clinical audiologist, and I have my doctorate from the A.T. Still University in Arizona.
Cool. So, I mean, audiologist, you would assume it has something to do with hearing, but what exactly is an audiologist?
An audiologist is anyone who evaluates people's hearing levels, their abilities to communicate, provides amplification or hearing aids. We also evaluate balance systems, auditory processing. There's a whole realm of things, but primarily just finding out what you're hearing, how you're hearing, if you need hearing aids,
right.
Especially children, checking them when they have ear infections, that type of thing.
Gotcha. Sometimes I feel like some of the men in my life, they don't really have a hearing problem. It's more of a listening problem. Would you agree?
Yeah, we often get that complaint about the selective hearing. So
right.
Sometimes they actually do probably have selective hearing
right.
because they will come in and have normal hearing. But men, the problem is with hearing loss, men have a tendency, especially in the past decades, to have more of a tendency to have been around a lot of noise in their employment,
Gotcha.
more so than women. And so the problem with noise exposure is it affects your high-frequency hearing and causes high-frequency hearing loss. Well, women's voices have a tendency to be more high frequency.
Naggy is what you're saying? Are we naggy?
Well, actually, physically more high frequency. So, along with children's voices. So, there actually is a physiological cause
right.
for the difficulty hearing women.
So what
in
you're
their
saying
lives.
is we can't blame it on them.
We can't.
I'm kind of disappointed. I'm going to have to call my fiance and let him know.
Yes.
Yeah.
They actually.
So, how important is hearing health then?
Well, during graduate school, one thing I'll say is they had us wear earplugs, for about 3 days. That's very difficult. You don't realize that everything you do, your environment and your surroundings, everything to communicate, to have
impacts
any kind of yes, it impacts everything throughout your life. If you're born or you have a hearing loss as a child, as you grow, you will, if you do not hear well, you will not learn speech clearly. You will not learn to read properly. And that affects everything throughout your educational system. So, and then it also affects your ability to, as an income earner. It can negatively impact
right.
every aspect of your life. Now, if you are an older adult or, middle-aged, you would start to notice you have more difficulty with socializing. I don't want to go to that event. I
right.
don't understand what people are saying. We get a group of people, and I'm always left out, or we're at a restaurant, I'm guessing what
sure.
people are saying. So it starts to interfere with a lot of your socializing, and it can be very isolating.
Yeah, I was about to say, I can imagine it would be incredibly isolating.
And people have a tendency to want to, I don't want to do this, I don't want to, that
right.
indicates that I'm older. But in actuality, if you don't understand people, or people have a tendency to think, well, what's wrong with you? Are you a snob, or are you, they don't realize it's a hearing loss.
Right.
Because hearing loss is invisible. You can't
sure.
see. Like if you have a broken arm, I can see you have a broken arm.
Right.
But when people have hearing loss, people don't always realize that that's the problem. So in a lot of cases, it's just better to go towards the hearing devices if you need them, just to keep your lifestyle and to maintain a lifestyle that you're used to.
So if you have a patient coming in and they're concerned about their hearing loss, what are some of the ways that you're evaluating that?
typically you come in, we will go over and do a history, a hearing history, family history. Is there any hearing loss in the family?
And there are some genetic components to that as well.
There can be genetic components, especially with younger people who have hearing loss, or you may have somebody who has a hearing loss in one ear and they've just always dealt with it because the other ear, the brain is very good, very plastic, and it will compensate for that deficit in the ear. So you can often find that if you continue, as far as the symptoms, or what we do, is we do just a basic hearing test, which involves speech. It's not like a screening that you'd have at a school or at a work in place.
Sure.
You actually do pure tone testing, bone conduction testing, where we put a bone device to actually test your nerve. And we also do some speech testing to see how well you hear, if sound is loud enough. Because even if sound is loud enough, depending on the frequency of your hearing loss, which frequencies you have the loss, you still may not understand well. So we have to watch that.
Sometimes when I think of hearing aids, I always wonder how effective they actually are. Do you have different levels of quality in hearing aid, or is it like, how effective are they?
At one point, when I first got into in the early 90s, you would say some people you just would not have success, but that's not the case anymore because hearing aids now have a computer microchips. The smaller all the technology gets in the world, the smaller the technology and the more advanced the technology is in the hearing aids. So for the majority of people, unless you are some profound type of hearing loss or had some sort of injury or trauma where you cannot understand speech, even if it's loud enough, the majority of the population will do well with hearing aids. And I'm not just saying that because I provide hearing aids, but because they have made such an improvement. And the comfort level, a lot of the issues people used to complain about with hearing aids was not actually that they didn't hear well, it's that they heard too much. They hear things they don't want to hear.
It's like being able to read someone's mind or something.
And also comfort. They didn't like how they felt. And it's giving that adaptation time is very important. But what people will find, especially if you lost your hearing gradually, which most people do, especially if it's noise or age related, over time, you get used to not hearing. And honestly, you don't want to hear some of these things, like your refrigerator coming on, the air conditioner vent coming on.
Sensory overload, I would imagine.
I'll be typing. To you and I, who have normal hearing, typing on the keyboard is just a normal sound. We don't even pay attention to it. But people who don't hear don't even realize that keyboard made sound until all of a sudden they've got hearing aids and all these environmental sounds that we're used to, we just ignore them. Or all of a sudden seem like overwhelming. Why is that so loud? These hearing aids are the problem. It's not the hearing aids. It's that your brain has to reacclimate itself to hearing because you have not been.
Well, this is a bunch of great information. I'm sure some folks are going to have some questions. So as we're wrapping it up, can you just kind of point them to resources, maybe a website or phone number they can call?
As far as contacting, I'm at Baptist Medical Group and Audiology. We have a website. It's Baptist Medical Group.
.org, I think.
.org, yes, it's .org. That's the difference. Whenever you were trying to get into Baptist, you would go through .org. And then the phone number that you can contact
I think will be on the screen. We'll have that on the screen. But thank you so much for joining us. We really appreciate it. I think this is great information. People are going to learn some stuff today.
Thanks so much for having me.